Hi guys, are you curious what your labor and delivery room will look like? Well, let's go ahead and show you what it will look like, okay? I'm Haley. I'm with Pregnancy, Birth, and Parenting 101. I am a labor and delivery nurse, childbirth educator, doula, lactation specialist, and mom of 2, soon to be 3. So let's go ahead and show you your room. Come on, welcome to labor and delivery. So when you first come in, most likely a nurse is going to greet you in either a triage area or, depending on how you look, and please, we don't need any actresses, because as soon as we check that cervix, we'll know how dilated you are. They may bring you straight to your labor room. So whether you're in a triage room or a labor room, one thing you can expect is that your nurse is going to ask you a lot of questions. She's going to bring you in, come on in. She's going to have you change into a gown, maybe leave a urine sample, and then come over to our bed. We've got a couple different monitoring systems. One which will look like this and hook up to here and you'll have straps on. Or the other one, which is called the Monica Novi, and you can always call your hospital and find out if they offer this one or not. It's a Bluetooth one. It comes in a package like this. Oh, this one's already open, so I'll just go ahead and pull it out. It literally looks like little electrodes, and it goes right on your belly, and then you don't have to be hooked up to all this stuff. So the first thing they're going to want to do is hook you up to a monitor, see how baby is doing on the monitor, see what your contractions are doing, and then they're going to get you all checked in. They're going to ask you about your medical history, your surgical history, what baby number is this, when your contractions started, if you're group beta strep positive or negative. These are some really great things to go ahead and just type up and give to your labor nurse, because if you're in active labor and you're really uncomfortable and you're breathing through your contractions, the last thing you want to do is answer all these questions. So you can also Google, what are the typical questions they ask when you get to the hospital, and get a whole list of them. And I recommend go ahead and typing those up and bring them into your labor nurse. Also, you'll want to go ahead and give her, if you have any birth preferences typed up for you and baby, give them to her at that point as well. So as you can see here, this is our labor bed. It actually comes apart, and yours at your hospital might be a little bit different. This one, you can labor in many different positions, and I'll do a separate video on that. But what's really nice is it actually comes down and moves out of the way. And then this is where the doctor or the midwife will stand to catch your baby, because you're the one birthing your baby. They just are there to catch it. If we turn around, make full circle, what you'll see here is what your typical bed is going to look like for daddy. So whether you're in induction or you're in labor and you get an epidural, partners get a chance to sleep and rest as well. This is a pretty large room for labor and delivery, depending on how yours looks, but I recommend taking a tour of your hospital. You can schedule a tour beforehand so you can visualize it, you can see where you're going to be. And then also, they no longer recommend separating baby, so baby will come right here. After you do an hour skin to skin, we'll bring your little peanut over here in this nice warm radiant warmer. We'll do the weight here, the measurements, if you're going to get the recommended baby medications, so erythromycin, vitamin K, and Hep B vaccines. Those are all some things to talk to about your pediatrician. And of course, a little diaper and footprints as well. There are certain nuances that are done differently at each hospital, but overall, this is kind of your typical setup that you have, and what you can expect. You can also expect that if you come in labor, that most likely your labor and delivery nurse is going to do a vaginal exam. And what that consists of is using 2 fingers in through the vagina, and what they're looking for is your cervix, and if it's open or dilated at all, if it's effaced or thinned at all, and they're looking to see, are you in labor? Are these contractions causing your cervix to open and dilate? And if they are, then most likely they'll keep you. Have you broken your bag of water or not? That's something you also want to include and tell your labor and delivery nurse. So this is just a really quick video I wanted to do for you guys to let you see what your labor and delivery room might look like. The other last thing I want to include is, depending on your hospital, you may or may not have a bathtub. Usually they all have a shower, and maybe not all rooms have the bathtub, so if that's important to you, then I would definitely ask if they have a room with a bathtub. And then if you're able to get in, usually the provider will be okay with you getting in as long as your bag of water hasn't broken. If it has, they may just let you get into the shower. And then they supply all kind of fun stuff like mesh panties to wear afterwards, and pads, and a pack of newborn diapers. But if you don't want to hone on our sexy little mesh panties afterwards, you can always bring your own. Just a heads up, things get pretty messy in labor and delivery, so if you want to keep it and bring it home, I suggest having a clear bag to bring it in, or just throwing it away if you're okay with that too, because like I said, things get pretty messy. That's to be expected though. I hope this video was helpful. If you have any questions, feel free to throw them in the comments. Don't forget to subscribe. Whoa, don't forget to subscribe and like. And yeah, remember, you got this.